Infertility means failure to conceive. Traditionally, it would be after 12 months. But really, if a couple are failing to get pregnant after maybe 6 months or more, that could be a good time to start thinking about fertility testing. Investigations involve both the woman and the man. On the female side, we would be performing an ultrasound scan to look at the uterus and the ovaries to make sure everything's fine, to exclude anything like benign fibroids in the uterus, or perhaps to exclude ovarian cysts in the ovaries. We might also check the fallopian tubes to see if they're open by injecting some dye through the neck of the womb, which is called the cervix, and then doing an ultrasound scan to see if the dye goes through the fallopian tubes. For the woman, we'll also be performing some blood tests, in particular a hormone test called Anti-Müllerian Hormone, or AMH, which measures the ovarian reserve, and it checks to see how many eggs are there in the ovaries. Other blood tests would be a thyroid test. We'll also be making sure that the woman is not anemic and that various other hormones are all fine. On the male side, we perform a semen analysis. The scientists look down a microscope at the semen analysis and they look at the number of the sperm. That's called the sperm count. They look at the motility of the sperm, which is a percentage of sperm that is swimming forward. We look at the volume of the sample, and we also look at what's called the morphology, which is the shape of the sperm. So we get all of those tests done. We can get them done in a very short time and get the results back to you within 24 hours or so of the analysis. So certainly we would then bring you back for a consultation with one of our very experienced fertility doctors. They would then go through all of the results with you, and then, very importantly, would come together with you to decide a plan, so the most appropriate fertility treatment for you to move forward to. Early fertility testing really gives you the information to help you make an informed decision about what you want to do with your fertility, whether that's just continuing to try for longer, or whether it's moving on to a fertility treatment, which could be drugs for the woman to help her ovulating, it could be advice with lifestyle, it could be insemination treatment, or it could be IVF. We are basing all of our testing protocols on what I've been using at the University of Oxford. We've brought that to the Kingdom of Saudi Arabia. We're making sure that we're using the best quality tests, which gives the most accurate results. What that then means is that you have the best information to help you make an informed decision.